Thank you, Mr. Speaker, and through you to the members, I rise today in strong support of this bill that's before us. I want to thank you, Mr. Speaker, for putting yet another important health care bill before this chamber. Once again, Massachusetts is leading the way on important health care issues facing the Commonwealth. I also want to thank the Chair of Ways and Means and his team for all the work that they have done to bring this to the floor and to make this a reality. And a special thank you to the Chair from Watertown, the gentleman from Watertown, who's worked so hard on what will be one of the most important bills that we vote on in this coming session. I'm also thrilled that this bill contains, for the very first time in the history of the Commonwealth, a special commission to study and make recommendations on the incidence and the impacts of the disease vitiligo and associated light-related diseases and disorders of pigmentation in the Commonwealth. This is critical that for the first time we have a commission on vitiligo. The commission will establish mechanisms in order to ascertain the presence of vitiligo and other light-related diseases and disorders of pigmentation in the Commonwealth, study successful models of patient and family education support programs, survey the extent of health insurance coverage for treatment and services associated with vitiligo, and make recommendations to improve patient access and awareness of innovative and affordable and beneficial treatments and services. For those who don't know, just very quickly, vitiligo is a skin disease that causes the patchy loss of coloring and pigmentation in the skin. And in some cases, and in many cases, individuals face total loss of all pigmentation in their skin. Vitiligo is an autoimmune disorder, and autoimmune disorders occur when the immune system attacks the body's own tissues and organs. And people with vitiligo, the immune system appears to attack the pigmentation cells known as melanocytes in the skin. Vitiligo is a common disorder affecting between 0.5% and 1% of the population worldwide. However, many cases are not reported, and some researchers suggest that the condition may affect up to 1.5% of the total population of the United States. Roughly 1.9 people are officially diagnosed with vitiligo in the United States, but medical researchers believe that that number actually is closer to 2.8 million people because in many cases patients go undiagnosed. Mr. Speaker, this is a huge issue. This is a health equity issue for not only the people of my district, but for the people of the Commonwealth of Massachusetts, and quite frankly, all over the country. I have the honor of representing the nation's largest vitiligo advocacy organization, VITFriends, which is located in Hyde Park in my district in the Hyde Park neighborhood of the city of Boston. Valerie Molyneux and Barbara Hamilton, who run this group, are literally national leaders across the country advocating for patients and for families and for individuals with vitiligo. And so for the first time, and with their leadership and their work, we're able to have this commission, and thanks to you, Mr. Chairman and Mr. Speaker, we're able to have a commission that for the first time puts the condition of vitiligo in a conversation around health care, around how we can treat vitiligo, around how we can make sure all health insurance plans cover vitiligo, to make sure that Mass Health and our private insurance plans done. What is our pharmaceutical industry doing? How can we make sure that all the latest innovative and beneficial treatments are available for those who have vitiligo? And just in closing, Mr. Speaker, it's not just the health impact, but it's also the social and emotional impacts of vitiligo as well. There's a huge mental health component for people who have vitiligo, particularly young children, students in schools who are often bullied, who are often physically assaulted, who are often taunted because of their skin condition, vitiligo. Many people feel it's contagious, and we know that the medical history shows that it's not. In fact, VITFriends often tells a story of even recently, in this day and age, where an individual had a severe case of vitiligo and went to a local shopping store to buy their groceries, and when the cashier rang the groceries all through, she tried to hand a $50 bill to the cashier, and the cashier backed off and said, "Put it on the conveyor belt, put it on the counter. I'm not touching your money." Because that cashier thought that this person was contagious when in fact they had the autoimmune disease vitiligo. So this is a hugely historic day, I think, both overall for the passage of this extremely important bill, but also for those who suffer from vitiligo, from those who advocate for vitiligo, and for our friends in Hyde Park who operate VITFriends. It's a day that they now will be able to use to advocate more in this chamber and across the Commonwealth for their disease. So I urge passage of this bill. Thank you.